All right, we're back now with state epidemiologist Dr. Benjamin Chan. You at home have been sending us questions all day long. Dr. Chan, here we go from Mark. Ashley asks, there's a lot of talk about the third shot being much more beneficial against Omicron than just 2 shots. Can someone who has only had one J&J shot plus one Moderna shot booster have access to a third shot, especially if they have risk factors?
Yeah, so the number of vaccine doses that somebody can receive is going to depend on a couple of things. One is what they got for their primary series of vaccines, and the other is if they have underlying medical conditions. If somebody got the single dose J&J Janssen vaccine for their primary series, then what is recommended and able to be given to that person is a booster shot at least 2 months after that single dose J&J Janssen vaccine. For people that may have gotten an mRNA vaccine like the Pfizer vaccine or the Moderna vaccine, that's a 2-dose primary series. And for people that are moderately or severely immunocompromised, they can potentially get a 3rd dose extension of that primary series on top of a booster dose after that. So how many doses somebody can receive is going to depend on what they got for their primary vaccination series.
Okay, you got me on that mRNA booster. I thought that was Moderna, but you've explained it well. Dr. Kathy asked, how do you know if a person has the Delta variant or the Omicron variant? Where can these tests actually be done?
So the only way to identify and confirm whether somebody has one of these variant infections or to identify the strain of the virus causing infection is to do genetic testing or genetic sequencing. These are not common tests that are conducted in most hospital or commercial laboratories. Our public health laboratory and some other academic partners conduct the genetic sequencing that is required. The CDC conducts this genetic sequencing, and then there's a contract with some of the large national commercial reference labs to do some of this genetic testing. But if a provider has a specimen that they would like to have testing done on for genetic sequencing, they're always welcome to send it to our public health laboratories. But there are restrictions in terms of whether or not we can report back those genetic sequencing results to patients and providers. So providers that are interested in sending specimens in need to be aware of some of those restrictions, that they may not get a report back on what variant is causing the infection.
Good stuff. So Annie asks, I am over 65 with a chronic condition, fully vaccinated and boosted. I'm concerned about going to indoor holiday gatherings where there may be unvaccinated adults and children. If I wear a mask but others don't, will I be adequately protected?
Yeah, so you've done the right thing, I think, in getting fully vaccinated and getting boosted. Everything is a spectrum of risk, however, right? So the goal is to minimize risk. And it's hard to assess specific situations, but certainly we want people who are fully vaccinated and boosted to be able to have more freedom, particularly around the holidays with gathering with friends and family. But there are steps that you can and should take to protect yourself. Limiting the size of group gatherings is going to be important. And if you're concerned about the situation that you're entering into, wearing a face mask is a good idea. But there is always going to be likely some risk to being exposed to COVID-19. There are very few scenarios in which there will be zero risk. And so the goal here is to try and minimize the risk of exposure to a level that's acceptable to you and your family.
The bottom line, use your smarts. Doctor, thank you. We'll be back with more questions in just a moment.